Hello, I'm Elizabeth Vargas, and welcome to 2020 in Touch. Here's a look at what we're working on for this week's program.
That scratch was a baby moving, and he just kicked at me again.
Since the age of 8, I always wanted to be a doctor and come back home and practice medicine where I grew up.
Dr. Linda Moses grew up in one of the 3 Memphis zip codes where babies die at the same rate as in some third world countries. Dr. Moses divides her time between the public hospital, the Med, and this health department clinic in her old neighborhood.
Make sure you're on the way down on the symphysis.
Every week that the fetus stays in the womb makes a huge difference in the health of a baby. Doctors say if every premature birth could be delayed even 1 week, the infant mortality rate would go down dramatically.
There you go.
How much of your job, I guess, is basic education?
All of my job is basic education. Every contact that I have with a patient, my goal is to impart some knowledge and give her permission to ask questions. I think one of the things with prematurity and infant mortality is the reason it's so rampant in communities where people are less fortunate is because the knowledge is not there. We need people in the community that could influence young people to do better with their lives.
Some health department clinics also have nurses who make house calls. Vivian Davis goes to patients who have a history of difficult pregnancies.
You know how the old folks used to do back a long time ago? Well, she likes that. And you know,
Studies have confirmed that this kind of one-on-one contact with a visiting nurse is one of the most effective ways to influence the health of a low-income mother and her baby.
helping that gas move around.
Yet, the home visitation program has steadily lost nurses as the Memphis and Shelby County Health Department has had to cut its budget. For those who come to the neighborhood clinics, hours and services also have been reduced. This is the clinic where Dr. Moses works, never open in the evenings and open only half a day on Fridays to hold down costs. If you could wave a magic wand and change something, what would you change? What would you do?
I think money will make a big difference.
Why do you think people don't want to spend the money on,
Children don't vote. Babies can't vote.
But everybody
Poor
loves a
people
baby.
don't vote. Yes, they do. Everybody does love a baby.
So then why aren't more people more upset about the number of babies who die because they're born too early?
I think it hasn't hit close enough to home. And sometimes we just don't know. But ignorance is not always an acceptable excuse for not doing things.
And we hope you'll watch 2020 on the air every Friday night at 10 o'clock, 9 o'clock Central. And keep stopping by online for our daily webcasts and previews of our upcoming stories. I'm Elizabeth Vargas. For all of us at 2020, we're in touch, so you be in touch.